Hello everyone, welcome to Mindspeak on Herald Global. I am Saimik Sen. On the occasion of the World Tuberculosis Day, joining us today Dr. Brigadier Ashok K. Rajput, a distinguished pulmonologist and sleep medicine specialist with 37 years of service in the Indian Army. He is a senior consultant physician and pulmonologist at the CK Billa Hospital. So, first of all, thank you so much for taking out this time for us. Welcome to Herald Global.
Thank you very much. Yeah.
So let me begin by asking you, what made you choose pulmonary disease as your specialization?
No, it is not a choice, it's a default.
Okay,
You know, whatever specialization you get in this era where a lot of competition is there, you may not get your first choice, you may not get your second choice. So I got it. Before that, I got, MS surgery. So I thought it is not my taste. So switched to uh, MD in respiratory disease.
okay. So how far India has come in tackling tuberculosis in the last 2 decades, according to you?
No, we are same. No, whatever incidence, whatever prevalence was there, since the time, it's more than 45 years working in this tuberculosis and patients or respiratory disease, I find the same incidence and the prevalence. It does not change.
Okay. So how does the healthcare system contribute in spreading awareness about the disease? Do you think we are doing enough?
We may be doing enough, but is it reaching whom it should reach is a challenge.
Okay.
You know, you may uh, do campaigns and awareness, that may be logical for the educated class, those who, hear for the, uh, health forums and other things and read about it in print media. And rest of the population where the incidence and the prevalence of the disease is low in a lower socioeconomic group,
So,
they are least bothered. They don't, awareness is nil in amongst themselves.
okay. So can you tell us about some misconceptions which needs to be addressed about the disease?
Misconceptions in the sense, in media we hear that any cough more than 3 weeks can be tuberculosis and one should, uh, chase it, look for it, get an X-ray.
Okay.
But problem lies, people tend to ignore. They go to, the mm, local doctors who may be qualified, may not be qualified. They keep on giving cough syrup off the shelf. People take cough syrups, especially for pulmonary TB, and see the diseases like this. It can linger on for years together.
Okay.
Years together, the person may cough, he may have some low grade fever, he may sometimes eat, sometimes doesn't eat, he keeps on working. So the tuberculosis, has adapted to live with the humankind. So the unless until drastic symptoms occur, like blood in the sputum, in which
Okay.
somebody gets scared, he runs to the doctor. Just for cough and little bit of aches and pain and fever, they don't visit the doctor. They won't get their X-ray, their sputum examination, and most of the people who are affected are smokers also.
Okay.
Rickshaw pullers and laborer class. So they smoke also, and they assume that the cough is because of smoking. They keep on coughing and keep on suffering from the disease. And by the time it is diagnosed, they have already have a disease of around 3 to 6 month duration, and they have already spread to many people during this time.
Okay, so please tell us about some of the measures that somebody can take, okay, so that they can protect themselves from the disease.
Yeah, so one of the measures is the cough habit and etiquettes. COVID taught us a lot. COVID taught us a lot. COVID
Sure.
infection, whenever somebody, coughs, people were masking and they were keeping distance. Why can't, that cough etiquette habit be inculcated in ourselves? It
Sure.
means whosoever has cough, he should not cough openly and spread the aerosol in the environment. No? He should himself isolate himself, and wear a mask and
Sure.
spitting in public places. And you see anywhere, the habit of chewing tobacco and spitting everywhere, coughing everywhere, and not only they don't take care of themselves, they don't take care of the society also. When you are coughing and the disease is spreading.
True.
So overpopulation, overcrowding, uh, poor air quality, smoking, pan, spitting, all these things, should go away. Only then, you see, when the strata, you see how the Western world have got control over the disease is, nothing very new. They
True.
just have their society has improved, their affluence has improved, their population is controlled. So just good living, good sanitation, well ventilated house, no overcrowding. That's how the disease has gone from that.
Actually, COVID
So
has taught us a lot, actually.
yes, COVID has taught us a lot. Whatever COVID taught, we forgot immediately. We thought it was, COVID only. Mind you, same thing if it is practiced, we can have drastic control in tuberculosis.
Okay, so let's talk about some stigmas which is attached to tuberculosis. Like the way it used to be in the earlier days. Does those stigmas are still there in today's time?
It is less because people have realized there are many people who have been treated because of the newer drugs which have come, drugs like rifampicin, which the duration of treatment has shortened from 1.5 years to 6 months, and people have been cured of tuberculosis. They are living normally. So at least majority of people know that it is treatable, it is controllable, and maybe some old thoughts, old schools in few people, maybe having some stigma. I don't think it is much stigma because of the media, because of everything, awareness, and what we are talking. Uh, Most of the people know that it is an infectious disease and there are medications there. So it can be, cured. So this is one of the diseases which can be actually cured and very good results if treated early and promptly and full duration. The why we are failing is because person gets all right in 4 to 6 weeks time. The cough
True.
disappears, fever disappears, appetite improves, weight gain starts, everything is okay. So continuing for 6 months is a challenge. That guy feels, why should I continue? I'm all right now. So spontaneously fallouts are there, and incomplete treatment leads to no relapse or recrudescence or resurgence of the disease. And this disease then sometimes because of this partial or incomplete treatment leads to multi-drug resistance, which we never heard of, say, 40 years ago,
Sure.
but it's a problem, big problem now. So it's a man-made problem.
Of course.
Multi-drug resistance is a man-made problem.
Okay,
Yeah.
so what do you say about those people, not only who come across tuberculosis or other diseases, okay, but what they do is basically they go online to figure out what has happened to them instead of visiting the doctor, okay, and
Yes.
there are so much of different information which is online, and they tend to get
Yes.
confused.
Yes. I
So,
fully agree with you. Fully endorse your this thing statement. It's common. Most of the people who come to me, it is not only for tuberculosis, for any disease. For any disease, this Google and online, search either they get scared or they get their path changes. They are directed into a different path. So it's a fact. And why it occurs? Why it occurs? That is the challenge. It occurs because if they visit a doctor, they have something in the mind that one, they will have to pay, give consultation fees, they will have to spend money, and they have a feeling that doctor write unnecessary investigation, like sputum examination or X-ray or CT scan. And in tuberculosis, as the medical care has improved, those who are sputum negative but the X-ray shows some shadow, bronchoscopy, removing sputum from inside by putting in a small tube, which we call bronchoscope, just like an endoscope.
Sure.
And and these are very expensive. Let me tell you, bronchoscopy costs 15,000-20,000 rupees. The
Okay.
whole treatment may not cost that much. The whole treatment medication may not cost that much. So the one in our country, it's a commercialized medical treatment. You see,
True.
majority of the people, they don't have trust in the government setup or hospital. Reason being, they are overcrowded. Hospitals are overcrowded. If you go to any tuberculosis hospital, there are huge lines and huge bunch of patients who have come there, and a few doctors. See, unlike in the Western world, where they see only 4 or 5 patients a day, here you see
Yes.
200 patients a day. Poor doctor sitting there is seeing 200 patients a day. So you can't do a justice. So they go to a private setup, those who can afford. And once they go to private setup, they have to spend money and it is expensive. I
Of
feel
course.
medical treatment should not be that expensive. It should be, some free or sometime less expensive, so that everybody can be treated, and only then it can happen.
Okay, just for my information, is there any specific population that is vulnerable to tuberculosis? Like, especially people
Yes,
who are into smoking,
yes,
per
yes,
se?
yes. Yeah. You see, entry of tuberculosis bacteria occurs in almost everyone. So by
Okay.
the age of 15, 16 year, when you are adult, half of us, the entry of bacteria has occurred. But the disease does not occur. Our immunity, our resistance, stops the disease over there. It is only when the immunity wanes off that the bacteria starts multiplying. Otherwise, it sits silently in the body, what we call as latent tuberculosis. And what are the situation in which it multiplies? When our immunity goes down. So immunity
Okay.
goes down in diabetics, in those who are on steroids, those who are on immunosuppressive drugs for other reason like arthritis and organ transplant, or those who have cancer and anti-cancer drugs. Diabetes is very common in our country, so diabetics are much more prone for tuberculosis. And not only this, the smokers, alcoholics, the malnutrition, they all have poor immunity. Sometimes, affluent population, they themselves do dieting, they are overweight, they do dieting. So their immunity goes down, and immunity goes down, they catch tuberculosis. So these are the population, which are more prone. Silicosis, persons working with stones and this thing, they are prone for tuberculosis,
Okay.
occupation wise. Smokers are prone. Alcoholics, they have poor immunity, they don't eat that well, and the immunity goes down, they are prone for tuberculosis. All chronic diseases, chronic liver disease, chronic kidney disease, chronic lung disease, due to other reasons, they have poor immunity. All those on steroids, all those on immunosuppressive drugs. Whenever there is an organ transplant, you give immunosuppressive drugs.
Okay.
So either they catch fresh TB infection, or the one which was lying dormant, I told you, the bacteria remains
Yes.
dormant inside and looks
Yes.
for an opportunity to multiply. So when the immunity wanes, then they start multiplying and they develop disease. That is how it is occurring.
Okay, so in your opinion, what are the most pressing challenges in the fight against tuberculosis?
Whatever I have enumerated, these are the challenges. First is the diagnosis. Early diagnosis is a big challenge. Then compliance with the treatment, affordability. One should be able to afford the medication free of cost for the whole duration, and one should complete it. One should not stop the treatment in between, whatever duration, 6 months or 9 months, whatever it is, they should complete it.
Okay.
And these are the challenges. And even a simple examination like sputum examination, which can clinch a diagnosis of pulmonary tuberculosis, uh, costs almost nothing, but it's a time-consuming process. The guy who is sitting there examining sputum, he has to spend at least half an hour in one patient's sample.
Of
So
course.
don't expect that he can handle 100 samples or 200 samples. So the quality will go down if he's handling more, right?
Yeah.
So time process, the labs, the equipment, the newer diagnostics have come up, the gene expert or line probe assay and other things have come, which are very expensive.
Of course.
They may cost, say, 5,000, 10,000 for the test, whereas the simple sputum examination will come for, 50 rupees for the test. So all those exotic, DNA tests which have come in the market, they are
Yeah.
very expensive. And procedure like simple X-ray, one has to go to the X-ray clinic, get an X-ray, get the film, get the report. This is all a time-consuming process.
True.
So people are scared, all those, they will have to miss days work, and this is a big challenge, the time, getting it tested, and awareness amongst the people, those who are smokers, who have coughs, they should be screened. They
Of
should be
course.
screened for tuberculosis before they, develop florid symptoms. So similarly, all those immunocompromised patients I told you, like diabetics, should be screened for development of tuberculosis at any stage. Of course, when they are visiting the corporates and other hospital, they are getting screened. All organ transplant and these immunosuppressive drugs, they are screened. So, but poor patient is not getting screened.
Of
Not
course.
they can't afford, they can't reach.
True.
The government institutions are not that many. We don't have that many government institutions to take the load of that large population. So, we are lacking the number of doctors, the number of technicians, and equipment and running a proper government institution. We are way behind. Way behind.
So
Yeah.
since you mentioned it, can you suggest some steps to improve the infrastructure of the medical facilities in our country itself?
Very good. Very good question. Everybody knows, yet nobody wants to speak. You may spend 10% of your budget on the defense, but will you spend 10% of your budget on health?
Of course.
The more you spend on your health, the budget, the allocation of the budget. If you don't allocate the budget to your health, means hospitals, the labs or equipments and other things, it's the priority. If the government's priority is health, they will spend the budget, they will see to it that it runs efficiently. Otherwise, people may be spending and not achieving. Means it may be eyewash.
Sure.
It may be eyewash. So whatever you are doing may be eyewash. Now in Delhi, Aam Aadmi Party has started mohalla clinics and all those things. But I don't think they have got any X-ray or sputum examination, or they follow up the patient, they diagnose tuberculosis. It is just for common cough, cold, and small things. They visit, they get the medication, that's it. There's one doctor, expecting to see, 100, 200 patient, general walk-in OPD patient.
Yes,
That is not a health care, proper health care.
of course.
Our Prime Minister is doing a lot, like he has opened many aims, like institution all over the country. So maybe in years to come, we will have more hospitals, more proper institutions which will work, dedicated. Tuberculosis is one of the lines. It's a national disease, I will say. It is
Of
a
course.
national disease. The number of patients our country is harboring, maybe around 40% of the whole world. We are harboring that number of patients here. It's a national disease.
Pretty amazing. The numbers.
Yes, it is. It is. We are overpopulated, and see, the incidence of tuberculosis may be something like prevalence may be 4 per 1,000. For every 1,000 people, there may be four who may be suffering from old or the fresh disease. Out of four, one is a fresh disease, three may be old. So that's a huge number. So every 1,000
True.
people you see, four may be suffering from tuberculosis in some form or the other. So that's the disease burden.
Okay. So my last question to you, okay, as a specialist in pulmonary disease itself, apart from tuberculosis, what are the major challenging pulmonary diseases that people should be aware of?
For all pulmonary disease challenge, lung is a very important structure. It's open to the environment. You see, heart is inside, it does not mix with the environment. Kidney is inside, liver is inside, brain is inside. Lung is a structure, the air keeps on coming in and we breathe out. So everything we breathe in will lead to something or the other. If it is just air pollution, it will cause more cough, bronchitis, asthma, and other diseases. If it is infection like tuberculosis, we have discussed, it may
Yes.
be COVID also. COVID, sudden pandemic, a disease like COVID, whatever is a respirable particle will create havoc, a pandemic. And then lung is a very important structure in the body. The whole blood from extremities, legs, arms, abdomen, everywhere. The heart pumps the whole blood into the lung and
Yes.
then it gets oxygenated and comes back. So, if the blood contains any particle, it is trapped in the lung and causes disease. So, very prone for infections which are getting trapped, very prone for cancer, the cells will get trapped. And for anything, we say lung is the mirror of the whole body. The whole blood is passing through the lung and coming back. So lung disease is very common. I feel the commonest disease the body may be having is the lung disease. It may be mild to very severe. It may be just a frequent viral infection every year, 2 to 3 times a person may be getting. It may be bacterial infection, it may be tuberculosis, it may be fungal infection, it may be cancer, it may be anything. It's very common. And even if there is no infection, just breathing a bad air, smog and the fog will cause bronchitis, the asthma, and related effects. If you can't breathe, you can't walk fast, you can't climb. You are a cripple.
Of course.
You're a cripple. So we see many patients of chronic respiratory disease who are respiratory cripples. They just can't walk to the washroom. They get breathless. They take a bath, they are breathless. Their oxygen level goes down. So very challenging lung disease, and tuberculosis, of course, is there from generations, and it is going to stay with us for generation, uh, especially in our country. This is my take.
Thank you so much, Dr. Rajput. It was very knowledgeable and it was very informative. And thank you so much that you could take out this time for us on the onset of World Tuberculosis Day. Okay, and I'm sure our viewers will be benefited through the suggestions and the kind of awareness tips that you have shared in this interview itself. Thank you so much.
Thank you very much. Thank you. God bless.
It was a pleasure talking to you. Thank you so much.
Yeah, same here.
Thank you. Thank you. Bye bye.
Bye.